of the world, morning, good afternoon, or good evening. On behalf of the Human Milk Bank Network in Southeast Asia, I am pleased to welcome you today on this gathering. Every year, the 19th of May is marked as the World Day of Human Milk Donation. This day is celebrated to create awareness on the importance of donating human milk, to promote human milk banking, and recognize the contributions of donors and human milk banks in supporting breastfeeding and optimal nutrition, in improving infant health and saving lives. This year's celebration has the theme Human Milk Donation, Solidarity and Peace in a Globalized World, and a slogan, Drops of Love for a Better World. This theme and slogan put a spotlight on how a mother's generosity and act of love of sharing her milk and the efforts of human milk banks to ensure that safe donor human milk are available to those who need it. It can bring all of us together towards one goal, that is creating a better world for our children and the future generation. Again, my warmest welcome to all of you to this webinar. We will be hearing from representatives from Myanmar, Philippines, Singapore, Thailand, and Vietnam. They will share with us updates on human milk banking from the respective countries, their accomplishments, and the wins over the challenges encountered in the past years. We will also hear their messages of solidarity for our celebration today. We hope that today we will inspire many mothers to share more drops of love and motivate many of you to continue supporting efforts on human milk banking so we can reach more mothers and children in need and save more lives. Thank you.
Thank you, Dr. Star. And now to give us his inspirational message is the Regional Technical Advisor for Alive and Thrive in Southeast Asia, Dr. Paul Zambrano.
Thank you. yung tingin.
Dr. Paul.
Thank you, Dr. Mel, and thank you, Dr. Star, for introducing the event and for welcoming all of us this afternoon. On behalf of Alive and Thrive in Southeast Asia, I would like to greet everyone a happy World Day of Human Milk Donation. And thank you for joining us this afternoon or morning or evening, wherever you may be in the world. In this gathering, we will look back at what has been a challenging time for human milk banks in the region and the rest of the world, but also to hear positive updates from colleagues in the region that we hope will be a source of inspiration as we all face a gradual return to normalcy. We are also here, as Dr. Star said, to express our solidarity with human milk bank colleagues from parts of the world that are now facing complex challenges, such as those resulting from the conflict in the Ukraine. Despite the ever-evolving global challenges that we face, we have much to be thankful for, such as the champions of human milk banking all over the world, many of whom are in this very webinar, who are tireless in their commitment to small and sick babies, wherever they may be, whether they are in neonatal intensive care units, whether they are in displacement camps, or whether they are even if they are in bomb shelters. And last but not the least, we are grateful and always humbled by the mothers who selflessly share their breast milk, even in unbelievably difficult circumstances, during the pandemic, amid armed conflict, and even after the death of their own baby. It is this act of love from which we draw inspiration and to which we pay tribute today and every day and every year at the same time. Once more, on behalf of Alive and Thrive, thank you for sharing your time with us, and we hope that you find this webinar informative, insightful, and inspirational. Back to you, Dr. Mel.
Thank you, Dr. Paul. As was mentioned, May 19 was originally celebrated in Brazil as the World Human Milk Donation Day, and is also considered a national event because on this day, the first agreement to create a network of milk banks in Latin America was signed by 13 countries and international organizations. So as human milk banks, we must address the issues and concerns regarding quality and safety of donor human milk. And it is for this reason that minimum standard guidelines were formulated and adopted by all human milk banks in Southeast Asia to provide the best nourishment to our sick neonates. We have invited representatives from our network members in Southeast Asia to give us their country experiences and challenges that they have encountered, especially during COVID, and at the same time, update us on their current practices and solutions related to the problems identified. Let us all learn and enjoy this day as we celebrate this life-saving gift of safe donor human milk. Our first speaker is Dr. San Min. She is a consultant and retired professor of neonatology in Myanmar. Next is our very own Dr. Aurora Libadia, who is the Director of Human Milk Bank at the University of the Philippines, Philippine General Hospital, and she is also the Treasurer of the Human Milk Bank Association of the Philippines. She will be followed by Dr. Pracha Nunt Narumit, who is a Professor of Pediatrics and Director of the Division of Neonatology at Ramatibodi Hospital and Mahidol University in Bangkok, Thailand. Next is from Singapore, Dr. Pooja Jayagopi. She is a senior consultant of the Department of Neonatology at KK Women's and Children's Hospital. And last, but certainly not the least, is Dr. Tran Thi Huang. She is the Deputy Director of Da Nang Hospital for Women and Children from Vietnam. She will also show us a video of their new human milk bank. So let us now listen to our first speaker, Dr. San Min, to be followed by all the country representatives. I encourage also the participants to type in their questions in the chat box so that we can entertain them later in our open forum. The floor is now yours, Dr. San.
You are playing my pre-recorded video, pre-recorded PowerPoint?
Yes, you can see it now.
No, I am using my telephone, so I can't make it here. You have to play from your side. I have sent the pre-recorded PowerPoint.
Yes, ma'am, we're playing it now.
Oh, sorry.
Thank you.
The audio is not playing.
Good afternoon, ladies and gentlemen. Updates on human milk banking in Myanmar. Currently, we have 2 human milk banks in our country. One in Central Women Hospital, Yangon. The Human Milk Bank was established in December 1994. And another in Yangin Children's Hospital, Yangon. The Human Milk Bank was established in 2016. Both human milk banks use their donor human milk for their admitted high-risk neonates in the NICU. The Ministry of Health wants to upgrade the present 2 human milk banks and to have 5 more in the 3 states and regions, 2 in Yangon, 2 in Mandalay, and 1 in Tangji in southern Shan states. In November and December 2018, facility readiness assessment tools were developed. facility assessment team assessed the 2 existing human milk banks and the 5 hospitals which have proposed for a new human milk bank. Now, what are the progress and achievements? In the early months of 2019, Myanmar national guidelines and SOPs for operation of human milk banks were developed and finalized. In mid-2019, training materials or a 5-day training course for HMB staff were developed. These were based on part training manual. 2 5-day training courses were conducted by our local trainers. These materials are to be revised and updated every 3 years. With the assistance of Alive and Thrive, Ms. Gillian Weaver, International Human Milk Banking and Consultant, in August 2019, provided two days HACCP training for the staff working in the 2 human milk banks. Parts HACCP training manual and Gillian's own PowerPoints were used. Gillian also reviewed our human milk bank national guidelines and provided invaluable inputs. Myanmar's first human milk bank upgraded to international best practices. Human Milk Bank at Yangon Central Women Hospital gives 500 infants the best start in life each month. This photograph was taken on 11 January 2020 at the opening ceremony of the upgraded Human Milk Bank at the NICU Central Women Hospital, Yangon. After the completion of all the trainings from mid-2021 to early 2022, all training materials were reviewed. Useful suggestions from trainers and trainees were added. We checked for mistakes and misprints till these manuals become flawless. These are the 5 materials that we had produced. Challenges and good practices. COVID-19 pandemic arrived our country on 23rd March 2020. Hospital guidelines for management of COVID-19 positive postnatal mother-infant couples were developed based on WHO guidelines. All well babies delivered to COVID-19 positive mothers were rooming in isolation wards and exclusively breastfed. Premature sick infants of COVID-19 positive mothers admitted to NICU were fed on mother's own breast milk with or without pasteurized donor human milk from the Human Milk Bank as deemed necessary. Now, the challenges with innovation. Children's Hospital Yangon is in dire need of human milk for their outborn high-risk neonates and neonates with surgical conditions. In late 2020, in the face of COVID-19 pandemic, the 3rd HMB at Children's Hospital Yangon became ready for operation. Virtual training on HMB and HACCP together was decided. Training materials were developed to fit in with this virtual training. The assistance was received from UNICEF and Alive and Thrive. 3 consecutive virtual trainings were planned between 18 January to 23rd March 2021. The eligible staff were split into 3 groups. The first group completed the training between 18 January to 5th February. However, training for the remaining 2 were to be conducted when conditions become feasible. Our future plans. We need to complete our expansion of the first phase human milk banks. The Ministry of Health aims to have one human milk bank in each state and region. In November and December 2022, we need to review and update our Myanmar National Guidelines for Human Milk Banks. This is the third year of development of these guidelines. We will incorporate minimum standards for the establishment of human milk banks for Southeast Asia during this review meeting. At the moment, we accept only hospital donors. Home donor human milk acceptance will be considered when circumstances become feasible. Our message of solidarity: raise awareness to encourage and support breastfeeding. Thank you.
Good afternoon. I will be discussing human milk banking in the Philippines. This is my disclosure statement. The objectives of my discussion. The Philippines comprises of more than 7,000 islands. With current population of more than 112 million, newborn mortality rate of 13 deaths per 1,000 live births, preterm birth rate of 13 births per 100 live births, and low birth weight rate of 21%. To decrease the neonatal death and improve the survival of each newborn, we need to practice the early essential newborn care, or the first embrace, kangaroo mother care, and breastfeeding amidst the COVID-19 pandemic. Each individual has the right to the highest standard of health. Breast milk cannot be replicated by artificial formula. Infants without access to their own mother's milk, donor milk is life-saving, the best alternative feeding option. In 1998, human milk banking in the Philippines was pioneered by the Philippine Children's Medical Center through the great effort of Dr. Gloria Ramirez, who also invented, with the help from Advanced Science Technology Institute, the local-made milk pasteurizer. In 2008, Dr. Jose Faglia Memorial Hospital, the National Maternity Hospital, under the leadership of Dr. Socorro Mendoza, launched its human milk bank. It had a distinct advantage of having a steady supply of human milk because of its KMC ward. In 2009, the Philippine General Hospital Human Milk Bank was formally launched through the hard work of Dr. Maria Asuncion Silvestre and the late Dr. Pura Flor Isleta. PGH has been serving the poorest of the poor, also giving pasteurized donor breast milk to premature and sick babies for free. The Department of Health created a national technical working group with the goal of creating a standardized national milk banking guidelines. A legislation, Republic Act 10028, encouraged health institutions to set up milk bank for storage and processing of milk donated by mothers. Currently, we have 27 human milk banks, and there are also other hospitals in the region trying to establish. The Philippines had fair share of disasters affected by calamities from volcanic eruption, typhoons, the fire incident, the COVID-19 pandemic. Due to its advocacy of responding to the call of providing aid during national emergencies. Milk Drive was also initiated. It was overwhelming response from different government and private units. The Human Milk Bank Association of the Philippines, or the HMBAP, encouraged these milk banks to save 10% of their stocks for future calamities. These are our challenges. The cost of the processing fee, which is high and not standardized since some of the milk banks are operated by private hospitals, and informal milk sharing practices. The HMBAP developed a position statement emphasizing the benefits of donor milk that should be provided safely to infants, not to engage to internet-mediated sharing and commercialization of breast milk is discouraged. Conduction of human milk bank training and other trainings were affected. Other challenges were there were decreased number of breast milk donors with increased demand of pressurized donor milk because of the separation of mother-infant diet during this pandemic, and regular breast milk letting activities were canceled, limitations on community-based strategy to support exclusive breastfeeding, and the reassignment of personnel of the Human Milk Bank to COVID ward or other wards. Despite the pandemic, virtual human milk bank training was conducted by HMBOP. It has incorporated the minimum standards for the establishment and operation of human milk bank in Southeast Asia. Also, because of the separation of the mother-infant diet, the position statement made by the Human Milk Bank Association of the Philippines and the Philippine Society of Newborn Medicine on the care of stable newborns is benefits of breastfeeding outweigh the risk of transmission of this virus. To strengthen the advocacy by providing learning materials to the postpartum mothers and providing NICU hotline numbers, online or face-to-face breastfeeding coaching and support of doctors, nurses, midwives, mother support groups, and other NGOs, and early telemedicine follow-up. This was the position statement made by the HMBOP and the Philippine Society of Newborn Medicine with our president, Dr. Melissa Rico. This was endorsed by the Department of Health, Philippine Pediatric Society, and the Philippine Obstetrical and Gynecological Society, emphasizing the non-separation, the early essential newborn care, breastfeeding, and kangaroo care, regardless of maternal COVID status, with strict implementation of the IPC measures, and expressed breast milk or pasteurized donor milk if the baby is separated from the mother. To increase the breast milk donation, there were collaboration with the local government unit, NGOs, mother support groups, private patients, medical societies via social media, and helping to recruit breast milk donors. Continuously promoted the benefits of breastfeeding and breast milk donation through social media platform, and joined the health conference to showcase their services provided by the milk bank and recruit breast milk donors. And also milk drive was continued despite the COVID-19 pandemic with strict implementation of IPC measures. Personal donor milk were picked up by milk bank staff using the hospital designated vehicle or ambulance or courier service. For screening of donors, standard questionnaire in Google form, then interview by staff through phone. So our message of solidarity and peace in a globalized world celebrate Human Milk Donation Day in Southeast Asia. Be solid. Our goal is to provide safe milk and optimal nourishment to our newborns. Thank you for your kind attention. Salamat.
Good afternoon, Chairperson, ladies and gentlemen. My name is Dr. Prashant Nandanamit. On behalf of the Thai Milk Bank, I would like to update the milk bank in Thailand and present some data about clinical impact and cost-effectiveness study of human milk bank in Thailand. Currently in Thailand, we have 6 milk banks. All are in the medical schools, 3 in Bangkok at Ramathipri Hospital, Sirat Hospital, and the National Institute of Child Health, 1 in the south at Prince Songkhanakarin University, and 1 in the north at Chiang Mai University, and the most recent one in the northeast at Khon Kaen University. As we know that human milk bank establishment is a high-cost investment, so we have a question about what is the clinical impact of milk bank, and would it be cost effectiveness or cost benefit of human milk bank in Thailand? The first study involved the clinical impacts of human milk bank at Ramathipri Hospital. This was a retrospective cohort study, reviewed the relevant data of very low birth weight infant 4 years before and 4 years after human milk bank establishment. 668 preterm infants were eligible. after exclude infant per exclusion criteria. Finally, there were 235 infants in pre-human milk bank and 282 infants in post-human milk bank group. We found that infants in post-human milk bank start feeding earlier with human milk, either by own mother milk or donor milk, no preterm formula at all. Interestingly, at the time of full feeding, we found that infants in the post-milk bank had more human milk volume intake, mainly from own mother milk, than those in pre-human milk bank. This finding indicates that having milk bank not only initiate human milk feeding earlier, but also promote breastfeeding. Most important findings were that feeding intolerance and necrotizing enterocolitis, or NEC, were significantly reduced by 50% from 13.6% in pre-human milk bank to 6.4% in post-human milk bank. The result of the clinical impact led to the cost-effectiveness study of human milk bank in prevention of necrotizing enterocolitis in very low birth weight infants, with the objective to determine the cost-effectiveness of human milk bank in healthcare provider perspective. In terms of effectiveness, we derived the data from the previous study that I mentioned before, indicate that incidence of NEC post-human milk bank had a relative risk reduction rate about 50%. In terms of cost, we analyzed the unit cost of donor milk from milk bank and found that the cost of donor milk from milk bank was approximately 112 baht per 60 milliliter, or $1.65 per ounce. Comparing all costs of milk pre and post milk bank, we found that in post milk bank, an average of milk cost was increased by 2,600 baht, or $77. Therefore, an incremental cost effectiveness ratio, or ICER, of milk bank showed that to prevent one case of NEC, we had to pay 41,000 baht, or $1,200. However, in cost-benefit perspective, infant with NEC compared with infant without NEC had a higher cost in all aspects, resulting in a higher total hospital cost with an average of 101,000 baht, or $2,900. Therefore, in terms of cost benefit, comparing the cost to prevent one case of NEC with the cost of having NEC, the cost benefit ratio was 0.41, which less than 1, meaning that benefit is outweigh the cost, indicating that milk bank is cost saving. In conclusion, in Thailand, we anticipate more milk bank in the future, and donor milk from the milk bank has shown to significantly reduce the incidence of necrotizing enterocolitis and feeding intolerance in preterm very low birth weight infants. Our study indicates that having milk bank is cost benefit due to reducing the incidence of necrotizing enterocolitis. And thank you for your attention. Good afternoon, Chairperson, ladies and gentlemen.
Good evening. I'm Pooja and I'm here to share with you regarding milk banking in Singapore. The KK Human Milk Bank is the one and only human milk bank in Singapore, and this milk bank was established in 2017. Over the last 5 years, the milk bank has evolved from supplying milk to sick premature babies within the government hospital to a national community milk bank, which now serves all sick term infants as well as preterm infants across Singapore, both in government and the private hospitals, Newborns who are well enough to go home, but they have medical conditions which could benefit from donor milk, such as those with cyanotic heart disease, and well newborns who don't have access to their own mother's milk. Either the mother has passed away, or the baby is given up for adoption, or the mother has a medical condition such as HIV, which contraindicates the use of her own milk. So far, we have received more than 15,000 liters of milk in donation from more than 900 donors. We have benefited almost 4,000 beneficiaries so far. Currently, we are engaged in efforts to establish PDHM as a standard of care for sick preterm infants nationally. We did face a few challenges when we set up. One, because we were the first and only milk bank, there was no available local guidelines or expertise on how to set up a milk bank. To overcome this challenge, a team went to Australia for 6 weeks to learn the nuances of milk banking from the experts there. After that, we also studied the Hambana and NICE guidelines, and that's how our milk bank guidelines are formulated. Being a multiracial country with a 14% Muslim population, the issue of milk kinship was thought to pose another challenge. Almost 30% of babies in our NICU are Muslim babies. So we approached the Islamic Religious Council in Singapore to seek advice on how their stance is about milk banking and milk kinship. After a series of discussions, they ruled that taking milk from a milk bank does not establish milk kinship, and a fatwa was issued in support of milk banking. This really helped to increase acceptance of donor human milk amongst our Muslim population. We have also published our experience regarding this matter in a recent publication. Another challenge which I think milk banks all over the world faced was the COVID-19 pandemic. So initially we were quite worried about maintaining a supply as we couldn't recruit new donors. Also, our current donors were sick or had to be isolated for contacts. But we did manage to maintain a sufficient supply. In fact, our supply went up and our average donation went up from 12 liters per donor to 30 liters per donor. We also introduced a courier service to pick up the milk right from the donor's home so that they don't have to make a trip down to the hospital. The milk bank also engaged in a lot of educational and research activities, teaching both lay people as well as healthcare staff about the benefits of breastfeeding during the pandemic as well as donor milk. On this occasion of World Human Milk Donation Day, we stand in solidarity with the milk banks across Southeast Asia in their endeavor to provide a ready supply of safe pasteurized donor human milk to all babies in need. Thank you.
Dr. Wang, would you like to share your slides?
Yes, can you see my slide? Hello.
Yes, we can see your slides. Thank you.
Okay. Good afternoon, everyone. I'm very glad to be here today on behalf of the Vietnam Human Milk Bank Network to update you on our human milk banking. So Vietnam is located in Southeast Asia with more than 98 million population, and our neonatal mortality rate is about 10 per 1,000 live births. The surveys from some neonatal intensive care units have shown that up to 40% of our newborns do not have breast milk in the first few days of life. And that is why the first human milk bank in Vietnam is located in our hospital in central Vietnam, was established in February 2017 after the support from Vietnam Ministry of Health, Alive and Thrive, and PATH. Since February 2017, the first human milk bank arrived. We now have another 3 full human milk bank, one in the south of Vietnam, that is Tu Dụ Hospital, and the 2 human milk bank in the north of Vietnam, and another human milk bank will going to be opened soon in Hồng Vương Hospital in the south of Vietnam. And we also have two satellite human milk banks, one in central Vietnam and one in the south of Vietnam. Here you can see our activities in different human milk bank in Vietnam. It's quite varied in the number of new donors, the average amount of raw milk per day, but on average, one donor donated more than 20 liters during their donation, and the contaminated rate is about 10 to 20%. In Vietnam, we are happy to have the first human milk bank guideline for the country in early 2021, when we wrote on the criteria for establishing a human milk bank in Vietnam. And also we described the human milk banking process and monitoring system. And also we described the list of essential equipment on the new human milk bank. And during the COVID-19 pandemic, we also created video clips for human milk bank training, so that we can show other hospitals who want to establish the human milk bank, but they cannot come to our bank to be trained during the COVID pandemic. And these video clips also describe on the SOP of the human milk bank. So the challenges during our human milk banking, we can see here that the cost of donor milk was not covered by the health insurance yet, and the family need to pay for the cost. And also the microbiology test for the samples is also highly cost. And especially in Vietnam, we don't have some specific equipment, so that we need to import the equipment from overseas. And as the challenge can be seen in other developing countries, the human resources are limited. So that for the human milk bank, sometimes we don't have enough staff. We also found the challenges that in the hospital, the breastfeeding support is not provided enough, and also the knowledge and practice among the mothers on breastfeeding is still limited. And around the community, we do have an informal milk sharing that may, sometimes limit our human milk banking operation. So for the solution and directions, we do have the national guidelines, and we also try to have national or international human milk bank meetings, so that we can share the experience around the milk bank operation. And we also try to have a continuing support from Alive and Thrive and other partners and global experts. And we also will open the Vietnam Human Milk Bank Network soon. We also actively participated in the regional and global network for human milk banking. And we try to have a mechanism for the health insurance to cover the donor milk costs. So finally, we think that to develop and to maintain, to sustain the human milk bank activities, we need to have support and promote the early essential newborn care, the kangaroo mother care, and breastfeeding support in the region. And for the region, we need to enhance our quality improvement practice and enhance capacity to cascade the human milk bank practice. And also we need somewhat the multi-center research for the whole region. And thank you very much for your attention.
Với trẻ sinh non, sữa mẹ có ý nghĩa vô cùng quan trọng đến sự sống của bé. Hàng ngày, Bệnh viện Nhi Trung ương tiếp nhận rất nhiều ca bệnh nặng là các bệnh nhi sinh non, nhẹ cân, nhiễm trùng. Đối với các con, chưa thể bố mẹ trực tiếp là một thiệt thòi lớn. Thậm chí có nhiều trẻ bị nhiễm trùng đường ruột không thể tiếp nhận sữa công thức. Ngân hàng sữa mẹ ra đời nhằm đảm bảo rằng tất cả trẻ em đang điều trị tại Bệnh viện Nhi Trung ương khi chưa thể bố mẹ trực tiếp vẫn có thể tiếp cận mọi lợi ích và hồi phục sức khỏe nhanh hơn từ sữa mẹ. Theo nghiên cứu, sữa mẹ thanh trùng giúp giảm 19% nguy cơ nhiễm trùng sơ sinh muộn ở nhóm trẻ dễ bị tổn thương, nhẹ cân trong vòng 28 ngày đầu đời, giảm thời gian nằm viện 15 ngày và giảm thời gian nuôi dưỡng tĩnh mạch tới 10 ngày so với sữa công thức. Mỗi ngày làm việc của tôi đều bắt đầu từ 7 giờ sáng với các công việc tỉ mẩn, đòi hỏi độ chính xác cao từ xét nghiệm sàng lọc sữa thô đến thanh trùng sữa. Công việc càng khó khăn hơn trong bối cảnh dịch bệnh Covid-19 khi nguồn nhân lực vận hành bị thiếu hụt. Đồng thời, chúng tôi phải luôn đảm bảo sắp xếp quy trình thu nhận sữa thô an toàn nhất cho nhân viên và bà mẹ hiến sữa. Tuy nhiên, nhìn các em nhỏ được ăn sữa mẹ, chúng tôi chỉ thấy vui thôi, không thấy mệt gì nữa. Chúng tôi cảm ơn sự đồng hành của 38 bà mẹ đã hiến 600 lít sữa cho 280 trẻ sơ sinh bệnh nặng. Bệnh viện Nhi Trung ương là bệnh viện hàng đầu Việt Nam trong lĩnh vực chăm sóc trẻ sơ sinh. Với ngân hàng sữa mẹ, chỉ đạo chuyên môn bởi Bộ Y tế, hỗ trợ bởi Chính phủ Ireland, Align Child và Newborn Việt Nam, bệnh viện sẽ càng làm tốt hơn vai trò của mình, đó là tận tâm vì sức khỏe trẻ em Việt Nam.
So this video clip show you the human milk bank in the National Children's Hospital, the latest human milk bank in Vietnam. And here, this is located in the Children's Hospital and in the north of Vietnam, and really the second largest children's hospital in Vietnam with the very big neonatal intensive care unit, who also provide kangaroo mother care, neonatal intensive care, and human milk banking that provide donor milk to very fragile babies in the National Children's Hospital.
Okay. Thanks everyone. So for sharing with us your time and your country experiences. I'd like to commend everyone for all the efforts made in your own respective countries. So we will now proceed to our open forum. Again, I would like to encourage everyone to type in your questions or even your comments in the chat box so that our panelists or the representatives from the different countries can answer any queries or any concerns regarding their lectures. So while waiting for questions from the chat box, as of now, I cannot see any question. Let me throw in the first question to the panelists. First of all, again, I would like to thank you for your for the efforts or all your efforts, in making this celebration, the Nation Day, a success. And based on your lectures, I just want to ask if there are policies that you made that was made during in your hospital or in your country during the time of COVID that had an impact during the time of pandemic. Do you have any policies that were made? in your own respective countries? Can I ask each and every panelist if can answer this question? Can you start, Dr. Au from the Philippines?
Hello. Thank you, Dr. Mel, for that relevant question. Actually, the separation of the mother-infant diet has really a great impact to the mental health, emotional health, physical for the mother, and the newborn as well. So the pasteurized or the donor milk should be prioritized to our sick preterm babies or sick neonates. And what's happening is if they're separated, but both the mother and infant are both stable, but because of the lockdown and the policies that were made during the early pandemic. So the Philippine Society of Newborn Medicine that was endorsed by the Department of Health and the Philippine Pediatric Society and the Philippine Obstetrical and Gynecological Society made this policy statement that if both are stable, the mother-infant, regardless of their the maternal COVID-19 status, they should not be separated. The zero separation, their early essential newborn care, or the first embrace. And the fourth step, which is very important, the initiation of early breastfeeding for the first 60 to 90 minutes of life. In the kangaroo care for our preterms, low birth weight infants, and the rooming in for both stable mother-infant diet. And if they're separated because the mother is critically ill, or the express breast milk, mother's own milk, and or the pasteurized donor milk. So there. Thank you.
Thank you, Dr. Au. How about from the other country representatives? Do you have any policies in your milk banks that have an impact on COVID?
Hi, I'm from Singapore. Yeah, so similarly, in the beginning of the pandemic, where not much was known about the virus, there was this tendency to separate the mother and the infant if the mother has COVID-19. But at that time, due to a lot of educational activities, we were still able to support these mothers by providing these infants with pasteurized donor human milk bank, human milk. And as more and more information came about, the policies changed where we realized, yes, it's okay to keep the infant together, the benefits of breastfeeding, the passage of antibodies, then breastfeeding was allowed. When vaccination came about initially again, we were not sure about the safety of the vaccine in lactating mothers. So initially it was advised that, breastfeeding should not take place. It was just a suggestion, should not take place for the first 5 days after vaccination. Again, we did support those mothers with pasteurized donor human milk. But then as more studies came about the benefits of the antibodies, even from the vaccine, then we started promoting breastfeeding and engaging in educating mothers on that.
Thank you. Thank you, Dr. Pucha. How about Dr. Prasha?
In Thailand, we initially don't know much about the COVID infection. So the initial policy is like not totally encouraged about breastfeeding, but after that we encourage breastfeeding, like rooming in with the mother with the precaution about the COVID infection. And for the milk bank, I think we don't have any much problem about the COVID. Only we have like a reducing number of mothers who donate their milk because of the hospital try to limit mother to visit the baby in the hospital. Thank you.
Thank you. How about from Vietnam?
So in our hospital, we give the early essential newborn care and kangaroo mother care with skin-to-skin contact and breastfeeding. Since the start of the COVID-19 pandemic, we have no time to disrupt that skin-to-skin contact and breastfeeding. And during the Vietnam social distancing, the Human Milk Bank in Da Nang also have the priority to go out to collect the milk from the donor. So for our region, I think we don't have any limitation, any restrict from separation or anything. But for throughout the whole Vietnam, at the initiation of the COVID pandemic, we also afraid of that transmission. So some hospital separate the mother and the babies. But now at the whole country level, we do have the national guideline to give breastfeeding and skin contact going with mother with COVID-19. Thank you.
Thank you. How about Dr. Sansan? Is Dr. Sansan still here? Yeah. Dr. Sansan.
It is mute. Yes, it's okay now.
Yes.
In our country, we don't have policy, but we have series of discussions with the administrators, OBGYN colleagues, pediatricians and neonatologists, and also with their other relevant personnel. And many of these meetings were done. And when WHO guidelines came out, we were very clear that it is very safe to give breastfeeding. Before that period, no mothers came in with COVID positive status. We are very lucky. And only after this WHO guidelines, we started to have these mothers with pregnant mothers coming in labor with COVID positive. So they were nursed in a isolation wards, but we follow all the rules of neonatal care, of early initial breastfeeding, and for the tiny newborns, and kangaroo mother care, and continue with breastfeeding, and if needed, donor human milk. That is decided by the neonatologist concerned. Thank you.
Thank you. Thank you, Dr. San. There are questions in the chat box that we need to answer. The first question is from an anonymous attendee. Can we pasteurize donors' breast milk if we were not able to do health screening on the mothers who donated? Who wants to answer the question? So do you still pasteurize the donor milk even if they are not screened based on your country experience? Dr. Au, can you do the honors of answering the question?
We have a standard screening questionnaire that is answerable by yes or no. But since it's a pandemic, we place it in a Google form, and it was confirmed by the staff by interview through telephone. So if, and also the serologic testing that has to be submitted, the HIV and the syphilis and the Hep B, the Hep B screening. So that's actually what is in the manual of operations. But if it is during the time that it's a emergency or in a disaster or a disaster, because it's a survival. It's during disaster you want to survive. So, and we lock this milk, and it has to be given to the infants or who are in need in the evacuation center. We may not do the screening, but if it's not during the disaster, it's a must. No, we want to ensure the safety and the quality of the milk, and also there are bacteria, the toxins that cannot be inactivated by the pasteurization. So we also get the bacteriological testing before and after the pasteurization. So that is the proper way. And we also, if we have a chance, we check if there are lesions on the breast with the physical examination. No, so it's the standard protocol. Thank you.
Yeah. How can you answer the next question, because it's also directed to you? So in the Philippines, do we have a standard protocol, particularly on the screening and pasteurization, which needs to be followed and adopted by those hospitals who wanted to put in their own human milk?
Yes, definitely. If you want to establish human milk banking, there's actually a process, and you need to undergo this training. No, and there is a protocol wherein you need to follow, and there is the manual, the manual, the operation of or the screening, the screening, the collection, the processing, the operation itself. Yeah, so you just need to write a letter of intent that your institution would like to establish a human milk bank to the president of the Human Milk Bank Association of the Philippines, Dr. Olona.
Okay.
Thank you.
Thank you. So are there any other comments from the other country representatives? Do you have any other comments based on the question? Actually, there are 3 safety nets. No? We are after the safety and quality of the donor human milk. No, it's not only the supply, but the safety, which is very important. So the 3 safety nets are the questionnaires, by which we do screening of based on the history and PE. Second is the laboratory test. We do cultures of all the milk, pre and post. And last but not the least is, of course, the pasteurization, which, as Dr. Rao said, which can inactivate almost all of the viruses and bacteria. So it's better, it's really best that we pasteurize, because that is the main goal, to have a safe and quality donor human milk. So I cannot see any more questions. Here, another question: who should shoulder the cost of the serologic test? Based on your experiences in your own country, who shoulders the cost? In Vietnam, who shoulders the cost of your test?
So as I said, the cost of human milk donor will be paid by the family. Currently, 1 liter is about 1,300,000 Vietnam dong. It's at about maybe $50 for 1 liter of donor milk, and the cost cover on the cost for pasteurization, electricity, and also the zero microbiology test. And it's not a cheap cost for a normal Vietnamese. But that's why we try to support and promote breastfeeding. We'll do the kangaroo mother care for very preterm babies as soon as we can, to have a mother own milk. And in our experience, the duration of a donor milk use in our NICU is less than 4 days for babies, and very small amount in the first few days of life. So try to remain the cost low for the family.
Yeah, I really agree. Really to advocate direct breastfeeding too, because there is a cost for the processing of all this donor human milk. How about in other countries? Do you have any other comments with regards to the cost? Is it the same in Myanmar? Dr. Lebadia?
In Philippine General Hospital, it's free, it's subsidized by the hospital. And I just want to give an important point for everyone who's here regarding the pasteurized donor milk. It would provide just a temporary solution. So if we have patients who are separated from the mother, even they are placed on nothing per order, we need to establish already the lactation. it's a standard of care that within 6 hours after birth, the milk should be collected already, then every 2 to 3 hours. So even if we have milk bank in our hospital, we need to empower them and let them feel that they are part of the medical team. So make sure once they are home, they would continue expressing their milk. And what happened in the Philippines during the quarantine, wherein the mothers were placed in a quarantine facility with no transportation. So she collected her milk every 2 to 3 hours. It's either she would drink it or discard. So the breast has to be emptied. So we need to establish and sustain the lactation even we have this human milk bank, and doing the kangaroo mother care once they are together and let them feel that they are part of the medical team. Thank you.
So I think that's the importance of having these policies, be in place so that they will be guided, with regards to the practices, like what happened during the COVID time, wherein mothers were temporarily separated because of lack of knowledge during the time, actually during the early days of the pandemic. There's another question here with regards to the screening test. If I may answer, in the Philippines, we do all these tests as a screening procedure. So how about in the other countries?
So in Thailand, we do the screening test like HIV, VDRL, hepatitis C, and hepatitis B virus, but no screening for CMV because we think CMV is already infected when we are the kid. So we do only like serology test that I mentioned.
Okay, thank you. How about in Singapore and Dr. Pucha?
Yeah. So in Singapore also, same as Thailand, we do the hepatitis B, C, syphilis, and HIV. But in addition, similar to what Dr. Gloria was saying, there's also a pre-serology screening questionnaire where the health and lifestyle questions are asked to mother, medication history, disease history. So that is also done. And we also do the bacteriological screening of the milk before and after pasteurization.
Thank you, Dr. Pucha. How about Dr. Wang from Vietnam?
In Vietnam, we have screening for HIV, hepatitis B, C, and syphilis. And this is paid by the health insurance or the donors when they come to the hospital for delivery. But after 3 or 6 months, if we repeat the test, then the Human Milk Bank will pay for that cost. And as I said, that cost from the Human Milk Bank will come to the family who pay for the donor milk.
Thank you. About Dr. Sansan? Can you comment?
Yes, in our country, the same screening test as in other countries. And for bacterial testing of milk, pre-pasteurized as well as post-pasteurized. Actually, in our guidelines, we have, because the cost for this test was free of charge, we thought that we couldn't afford to do both pre-pasteurization and post-pasteurization for all samples. So initially, we thought we would have pre-pasteurization samples every month and post-pasteurization samples for every sample. But depending on the number of donors and depending on the consultant's decision, they would go both pre and post-pasteurization for sometimes each and every sample, but sometimes following the guidelines, depending on the workloads.
Thank you.
Thank you.
Thank you, everyone, for all your insights. There are no more questions on the chat box. So once again, I'd like to thank all our country representatives for giving us and sharing us their valuable time and experiences so that we can also apply it in our own respective area of practice. So let me call now on Dr. Paul Zambrano again because we have videos from Alive and Thrive that we can watch. So Dr. Paul, can you introduce the videos to us?
Thanks again, Dr. Mel, and thank you to all our panelists who presented and answered the questions. So again, we are celebrating World Human Milk Donation Day, and the best message of thanks to our donor mothers comes from the children who received their drops of love when they needed it the most. And it's not often that we hear from them, and we have an opportunity to do that now in this video that was produced by the Global Alliance of Milk Banks and Associations Virtual Collaborative Network with support from the Government of Ireland, Alive and Thrive, and the Human Milk Foundation. The link to the video, which is up on YouTube, will be posted in the chat window, so please kindly view and share widely. So please enjoy the video, and thanks again to everyone.
Dear Milk Donor Mummies, my name is Max. I was born very early, at 32 weeks old. Now I have grown up strong and healthy. Even though I have never met you, I was fed with your donated milk through the first human milk bank in Croatia. Thank you for helping to feed me. And thank you to other mothers like you all around the world for giving millions of premature or sick babies donor milk and giving families this special gift. Thank you, and we love you.
I am very happy that I got donor milk when I was a tiny baby in hospital. Thank you to all the mums around the world who share their milk to help tiny babies.
Thank you, milk donors. Thank you, the milk.
Hi, in celebration of Human Milk Day, I'd like to thank all the people who donate milk.
So thank you for that very heartwarming videos. I think this proves to show that we need to continue providing donor human milk because the future of our neonates rely on our hands. So I would like to thank and salute all our mothers and dear donors for their kind hearts who, if not for them, we will not have milk for our sick neonates. We are all here to promote the health of our mother-baby dyad through the provision of safe and quality donor milk, and see to it that our mothers were given proper information and counseling on the importance of breastfeeding. And now, to give us the closing remarks, is the former National Program Manager of Infant and Young Child Feeding Initiative of the Department of Health. Let us all welcome the Vice President for Programs and Plans of the Human Milk Bank Association of the Philippines, Ms. Vicenta Borja.
On behalf of the Human Milk Bank Network in Southeast Asia, let me acknowledge and thank all the country presenters from Singapore, Thailand, Myanmar, Philippines, and Vietnam for sharing and providing us updates on the status of the human milk banking in their countries. Help us understand the challenges and learn from them how they were able to cope up, as well as in discovering approaches and conduct of studies relevant in human milk banking. Of course, to our ever supportive partner, Alive and Thrive, for their continued assistance to Human Milk Bank Network in Southeast Asia, and the untiring Human Milk Bank Association of the Philippines for organizing this webinar, Solidarity and Peace in a Globalized World, celebrating Human Milk Donation Day in Southeast Asia. And most of all, to all of you present here that make this activity extra special. Milk donation is the heart of human milk banking, for without donated milk, there is nothing to process to operate a human milk bank. Donated human milk is the life of human milk banking. As we end this webinar on solidarity and peace in a globalized world, celebrating Human Milk Donation Day in Southeast Asia, let us remember the significance of this day by strongly standing together as Human Milk Bank Network in Southeast Asia that protect, promote, and support breastfeeding to ensure continuous source of human milk donation for the deserving newborns and infants, nutrition, health, and survival. Thank you, donor mothers. You are heroes because you have helped and saved the lives of many newborns. While we live in a globalized world, there are certain natural practices and things to be preserved that could lead to solidarity and peace in globalized world. So let us be original and natural. Let's celebrate Human Milk Donation Day in Southeast Asia. Keep it safer through human milk banking. Congratulations and goodwill to all.
Thank you, Ma'am Beth.